Mental illness is a global problem. Depression is one of the leading causes of disability. Suicide is the second leading cause of death among 15 to 29-year-olds. People with severe mental health conditions die prematurely as much as 2 decades early. It can and does affect all of us, but it doesn't affect us all equally. So we know that the major causes of mental health problems are social. The wider economic social inequalities, what they mean in people's everyday lives, is having to use food banks, is having to make a choice between using electricity and gas or putting food on the table. And of course that has profound effects on people's mental health and well-being. And the centre really is about trying to understand mental health in those groups, in those populations who are most affected, so we can do something about it.
To achieve this, radically new approaches are needed that are interdisciplinary and intersectoral, starting with those who are the most vulnerable. This means giving children the best start in life, enabling young people to maximize their capabilities and control their lives, creating fair employment and good work for all, ensuring a healthy standard of living for all, creating and developing healthy and sustainable places and communities, and strengthening the role and impact promoting good mental health. This is nothing that researchers alone can carry. This has to be grown out of co-produced partnerships.
And what the centre is all about is generating, in partnership with affected communities and affected groups, generating the robust evidence that will inform the change that's needed.
But the centre is so much more, and so it would be really important to hear from our early career researchers, from our community partners who are doing the hard work to collect the data to influence society.
So there are 3 different programmes within the centre, and they are interlinked, but the first one is Young People and Social Change, the second one is Work and Welfare, and the third one is Marginalised Communities, and that's the programme that I work in. I think something that's different about the centre is that it puts partnerships and the communities that those organisations represent and support at the centre of what we do and how we do it. The boundaries between the centre and our partners are more porous than in other areas, and there seems to be more of a sort of a genuine will, desire to learn together, to accept critique from partners and to think about the ways that we're doing things in a different way. So I think for me it feels more genuine.
So my research is around people's experiences of employment, the welfare benefit system, and how those interact in complex ways with mental health. So within the work and welfare reform stream of work, we've got a focus on 2 strands really. One is precarious employment, so looking at how changes in the nature of work and the nature of the labour market are making work increasingly precarious for people and how that's affecting their mental health. And then the second stream is around the welfare benefit system, which over the past 10 to 15 years has become more conditionality based, and there's a large body of evidence showing that that is having a negative impact on people's mental health. So we're looking to contribute to that established stream of work, but I think to hopefully move it on a little bit further to look at the policy, what policy changes and policy proposals could help to improve this situation. The projects I'm doing with the Employment Support Organisation, we work together to develop research questions that would be useful for us as researchers and as academics, but also useful for them as an organisation. So that project's become a kind of light touch evaluation. I think they're really looking forward to finding out what the research interviews show to help them develop their service. But at the same time, we'll be using those the data to feed into sort of theoretical conversations and policy conversations to try and meet a whole range of needs and information interests.
Yeah, it's a white screen.
Is it white screen?
One of the projects we've been doing is called Reach. We've been following a cohort of around 4,000 young people from kind of year 7, so early secondary school, and followed them as they're getting older. And this group of young people are very kindly providing us with loads of information each year about their mental health and about things that we think might increase or decrease their risk of developing a mental health problem. And we're interested in the impact of social change and social transitions on the mental health, particularly of young people from disadvantaged and marginalised groups.
It's very difficult to speak about mental health because there's many things you can be scared of. If you do have the courage to speak to someone about it, then I do encourage you to, yeah.
think we've generated some of the most robust evidence really that we have in this country at the moment on impacts of COVID, because it's longitudinal data and we can see what was happening with the same group of young people before the pandemic hit. And we've done that together with young people. So we've had young researchers doing that with us, analysing the data, collecting the data and so on, shaping the work. Yeah, it's been brilliant. So we are in Dexter Playground in Brixton in London, and these are the grounds of the Big Kid Foundation. Big Kid are a partner of ours. They're a charity that work with young people who are at risk of kind of violence and exclusion from education and so on.
My relationship with Big Kid / Dexter's Adventure Playground goes back to when I was a young boy. I spent time here at the Adventure Playground as a kid. So it's really exciting to see what Big Kid are doing with it in terms of like refurbishing it and bringing it back to life. Young people in Lambeth, young black people in Lambeth are subject to a number of hardships, poverty, poor education, poor housing, research into mental health that will highlight these issues, but also highlight recommendations and influence support and practice to support young people with their mental health is really important. So as a part of the centre, we hosted the Young People's Mental Health Festival here, and through Black Friday, we hosted the workshop around police training and community training, what young people need in terms of their knowledge and understanding of stop and search rights. So we're co-designing training with young people.
I think what makes the centre really different is they sort of see working with people with lived experience and centering our experience as a privilege. And they see upskilling all of us to do our work as a privilege. And that's really nice and a really big change from other places I've worked, other academic centres, other universities, who sort of see it as almost like a burden or an extra step to get funding. The mutual respect around working together, especially in policy, I think is really difficult. And we have such an understanding of whose knowledge is the most valuable. And the centre is in a really good position to sort of really challenge that in the wider policy-making spaces, in the wider practice spaces and professional spaces, and to really champion the idea that experiential knowledge, yes, looks different, but is just as valuable and just as useful.
So this is the first dedicated centre that really straddles the line between society and mental health, that tries to make a difference for those most affected. It is important to us to really change the narrative, to change practice, to change policies and politics around these matters. We can only do this in partnership. So if you would like to get involved, if you want to find out more about the centre, get in touch with us to build these kind of bridges, because it takes everyone to improve mental health.